All right, everyone, we are on to chapter 13, which is the ear, the shortest chapter in the whole book, so that's pretty good, least amount of words. You'll see in these two pictures, we'll see again later on, but this is a picture of your eardrum, and we'll learn what the medical term is for that momentarily, but the left is a not so happy one right now, and then the B on the right there is what it should look like most of the time. Okay. What does the ear do? Pretty self-explanatory, right? It allows you to hear. Not everyone knows that it also gives you your sense of balance, so that there's a certain portion of the ear that really kind of lets your brain know if you're walking or running or on a boat and is responsible for giving you that seasickness feeling. The ear is really divided up into three main parts. We have the external ear, the middle ear, and the inner ear. And just by what's inside the inner ear, sometimes you might also refer to that portion as the labyrinth. So what does it actually look like? Here is the general labeled picture of your ear. It's the same as on page 503 in your book. All of your medical terms are associated here, and you can see also the divisions of where the external ear ends and the middle ear begins. Same thing with the inner ear, and so on. So that's kind of, we're going to go through these, what they do, why they're important, and give them some med terms to go with it. So on the outside, there are two key parts. So there's the auricle. It's also called the pinna. I am fine with you using them interchangeably. And then we also have the auditory canal, which is called the external auditory meatus also. So depending on what you want to call it, again, don't care. But that's going to be basically the tube that leads up to the next portion. The pinna or auricle is really any part of your earlobe that you would think of on the outside. And then the canal piece is the tube that leads up to the division between the external and middle ear, the eardrum. Fancy word for eardrum in this case is going to be the tympanic membrane, because it really is a membrane that separates the external auditory meatus, or that canal, to the middle ear cavity. And really what it's responsible for is vibrating. So you get the sound waves vibrating into your ear. Your external ear kind of funnels that sound down. It travels along the canal and hits on the eardrum. So your eardrum is going to vibrate back and forth, and when it does that, it's going to cause the ossicles, which are the three tiniest bones in your body here, to start vibrating too. They each have their own name: the malleus, the incus, and the stapes. You might have learned them once upon a time as the hammer, anvil, and stirrup, but we're in med terms, so we're going to give them special names. Collectively, they're called the ossicles. And another thing that's not super pictured here, just kidding, is the eustachian tube. That's the little drainage tube right here. It drains into the back of your nasal throat cavity. And really that's responsible for equalizing pressure in the middle ear. As you can see, it's kind of blocked off on both sides. So if you get an infection, for example, pressure can build up. Also, another reason why, if you're on a plane, they tell you to chew gum, because that tube and the chewing of the gum kind of equalizes the pressure in your middle ear, so your ears don't pop. We'll get to a couple disorders where, that drainage system is a problem. Continuing on, really I should go back one. This oval window piece right here at the end of the stapes, the oval window is going to be that dividing factor between the middle ear and the inner ear. It's kind of like a smaller version of the tympanic membrane. It's going to help transmit that mechanical vibration in the air to that in liquid, which is where this part comes in. This blue snail-shaped piece right here, kind of a big deal, is the cochlea, and that's considered your organ of hearing. And it connects the oval window, which you can see the ossicles from the middle ear here in this tan color. The oval window then connects to the cochlea, as well as the semicircular canals, which are these loopy guys, and the vestibule, which is where that connects. Inside those canals in the vestibule, that's where your balance is maintained. So there's little receptors in there that help you understand, if your head is lying down, if it's up, if you're moving, if you're not moving, and it gives you that sense of balance. What's not really pictured here and kind of added at the end is the mastoid bone. The mastoid bone is located in your skull behind the external auditory meatus. It's kind of a little bump behind your ear. It is pictured in your books too. You can kind of see it a little bit, but there is a bone component to this as well. So in terms of what you would hear in your sound, here's the flow of events, but basically sound gets funneled by the auricle through the auditory canal, bounces off the tympanic membrane or eardrum. That then causes your ossicles to vibrate and send that vibration onto the oval window. The oval window is then going to communicate that vibration to the cochlea. And the cochlea is where there's a ton of different tiny little hair cells, and it's fluid filled. So depending on how those vibrations transfer, those little hair cells are going to move more or less, fast or slow. And then that information is then communicated to the acoustic nerve, or the cochlear nerve as it's also called, and then sends that information onto the brain for processing. So that's kind of the series of events from the external to the middle to the inner ear. Okay, great. Now we need to actually put word parts to this. So the beginning of your word parts is going to start on page 506. And we have audio, which I feel like is pretty explanatory. That's going to be hearing. So it's not necessarily the ear structure itself, it's your ability to hear, which is why if you're having trouble hearing, you would go to an audiologist. Ori or oto means ear. So in this case, not to be confused with some of the eye terms, a lot of these, just to note, between the ear and the eye can be very, very similar looking. So just please be careful. People mix them up a lot. But most of the time I would say you would use oto. An otoscope would be the little thing that you look at someone's ears with. If you're looking at the ear, nose, and throat doctor, for example, we have the otorhinolaryngologist. Cochleo is for cochlea. Labyrintho is for the labyrinth. Again, as we mentioned previously, the inner ear is also called the labyrinth. So if you're really talking about any general issue with that inner ear portion that might not be, cochlear specific, then you would use labyrintho. Mastoido is specific to the mastoid bone. Myringo is your tympanic membrane or your eardrum. That's tricky because it doesn't really sound anything like its name, but I always think of, Myringo, ringing would be your eardrum. Not to be confused later on in the list with tympano, because you would automatically think tympano, of course, means tympanic membrane, but it doesn't. Tympano means, generally speaking, the middle ear. Like labyrintho means inner ear, tympano is focused to the middle ear, not necessarily eardrum specific. One I skipped would be stapedo, which would focus on the stapes, which is that third small ossicle that connects to the oval window. And then I have vestibulo, which is your vestibule, which is, again, that source of balance in the inner ear that is attached to those loopy canals in the cochlea. So if you have a diagram, I would say label it. Otherwise, in your book on 506, there's the diagram also that kind of goes through and does that too. All right, so eardrum. I didn't even try to trick you here. Hopefully you're saying A, Myringo. If I was trying to trick you, I would have put tympano, but myringo means eardrum or tympanic membrane. This is just a review of what I've verbally said of the differences in terms of general areas of the ear. All right, so hopefully your diagram looks something like this, just to kind of review of what goes where. Again, there's multiple terms to mean ear. Most of the time I would say we're going to use oto, whereas hearing would be the actual act of hearing, so that's audio, different than the ear structure itself. And then we talked about the differences between here. Some of these things that we're going to talk about don't necessarily have terms that go with them, like the auricle doesn't have its own special term. I don't know why cochlea isn't in here, but cochleo has a term. Okay. Oh, because it's right here. This is the same as the diagram on page 507. So tympanic membrane, same review question as before. Oops, don't know why that made it into the PowerPoint, but hopefully you now know for sure that the tympanic membrane is myringo. Okay, so moving on to diseases, which should be not so bad because we didn't have a whole lot of medical terms. So refreshingly, your list looks pretty small. And a lot of these terms should look very similar to what you've seen before in terms of the suffixes. So we have itises. Just like everywhere else, things can get inflamed. So if you're talking about the inner ear, it's labyrinth. If you're talking about the mastoid bone or the middle ear, or the tympanic membrane specifically. A weird one is otalgia. If you remember, algia as a suffix means pain. So normally we would combine that with oto, but we drop that second O because algia starts with an A. So otalgia basically is the fancy word for just saying you have an earache or pain in the ear. If it is a combination of ear and bone, we might use otomastoiditis. Kind of gross, but a thing is otomycosis. So if we remember, myco means fungus. So we have an abnormal condition of fungus in the ear. Most of the time that's going to be in your ear canal, right? Because fungus just doesn't magically appear. It might have gotten in somehow through your ear. Another weird, somewhat gross one, if we remember, rhea means discharge and pyo means pus. So this would be, ooh, my screen went crazy. Otopyorrhea would be discharge of pus from the ear. Yes, gross, but usually this would happen, for example, if you had an ear infection, so you had maybe some kind of bacterial infection, and pressure could build up and you could perforate your eardrum and have pus coming out, or just in general. Otorrhea is more generally just discharge from the ear. It could have some pus. It could also have some blood, just covering all bases, anything coming out of the ear. Lastly, we have otosclerosis. And that literally translates sclerosis as hardening. So this means hardening of the ear. But your entire ear is not actually hardening. It's really focused on the stapes. And so really translated, that means the stapes, that little tiny bone, isn't vibrating like it should. So it can't communicate the vibrations to the inner ear, and that's how you get some hearing loss. So please just try these on page 509. It shouldn't take that long. Get these words in your head. So not built from word parts is pretty short also, so that's good. Starting off, we have a neuroma, if we remember that oma is a tumor. So this would be a tumor of your acoustic nerve, also known as the cochlear nerve. And similar to any type of tumor, it could potentially cause damage as it grows. Cholesteatoma, cholesteatoma, mouthful, but if we remember, this would be a tumor of cholesterol. Usually this is associated with middle ear problems, and it starts to grow inside the middle ear. Meniere's disease is the third one. This is a chronic condition, so it usually comes through in different types of episodes, good days and bad days kind of thing, but it's a problem with the inner ear. And if you think about what the inner ear controls, it controls both balance and hearing. So that's why people with Meniere's disease often have a sense of spinning, which we'll learn is vertigo. That last term there on the list is this feeling that you are spinning, or everything is kind of revolving around you. Meniere's disease also has tinnitus, which is the ringing in the ears. And again, because of the nature of the disease, it also comes with some fluid changes in the inner ear, which can result in some hearing loss. So again, this is chronic, good days, bad days. It's not all the same. In terms of ear infections, we have otitis externa. So this would be inflammation of the outer ear. Typically, you would use this if you have some kind of outer ear infection. Otitis media would be inflammation of the middle ear. OM. If we're going back to word parts, these two things pretty much mean the same thing. Otitis media and tympanitis both mean inflammation of the middle ear. Presbycusis, we learned presby kind of as a word part-ish. In the last chapter for the eye, it kind of means with age. So presbycusis means hearing loss with age. Just like in chapter 12, presbyopia would be vision loss with age. So sadly, things start to decline with age. And I covered tinnitus and vertigo as symptoms of Meniere's disease. Give them a practice, exercise 10. There's some lovely pictures in your book on page 512 that kind of show you what some of these nasty things look like from the eardrum point of view. And then we can continue on. Here are some of those pictures. So this would be otitis externa. So this would be the ear canal. The eardrum would be hanging out back here, and you can see there's some kind of infection in that canal. And then this would be otitis media and or tympanitis, depending on what you would say. Again, this is the happy one here on the right. You can see that it's mostly transparent, and then when it becomes red and cloudy a little bit, it's inflamed. Typical ear infection. All right, ringing in the ears. Hopefully you're saying tinnitus. And we are to surgical terms that are built from word parts. So as long as you know the suffixes, I'm pretty sure you're set. Cochlear implant is considered to be from word parts because cochlear means pertaining to the cochlea. So that would be an assistive device that is electronically implanted for individuals who have lost some hearing. And basically it just bypasses the cochlea. So if we think about the hearing, if there are cochlear problems, then it can't communicate to the nerve and send impulses to the brain. So a cochlear implant basically simulates what that would be to stimulate the nerve directly. We can remove different things, whether it's the inner ear, the mastoid bone. If we're just cutting into the mastoid bone, we would have otomy. If you have perforated your eardrum and or need repairs, that could be a myringoplasty. Or sometimes, it sounds strange, but we would purposefully cut into the eardrum in a myringotomy. This would be an example if we had a middle ear infection and the pressure was building up behind the wall of the eardrum. Oftentimes, doctors might actually go in and just make a little incision to allow drainage as a better way than just waiting for it to perforate and have kind of ripped edges that may or may not heal well. Stapedectomy. This is going to be used when there is otosclerosis, for example, and that stapes is hardening. They might take that out and replace it with something else. to kind of try to restore hearing. And then tympanoplasty, this is kind of surgical repair of the middle ear. So looking at the eardrum and or any of the ossicles. Here's a picture of what that cochlear implant looks like. So, you know, on the outside, this is a heavy surgery that is involved, but you have a transmitter that sits on the outside with a little microphone to catch sound. And then the receiver is actually on the inside of the person's skull. You can kind of see that right here, or built into the skull there. Then there's a tiny little transmitter / electrode that goes straight into the cochlea, so then it can stimulate that cochlear nerve directly and kind of bypassing whatever hearing problems may have occurred. All right, so this is that example of a myringotomy when you might need to make an incision into the eardrum. Here's an example of a stapedectomy. So if this person, for example, had otosclerosis and this little stapes was hardening, they would go in and take that out. And here's where it would normally connect to the oval window. And then really what they can do is they make a little prosthesis, a tiny little fake stapes. It doesn't look exactly like the stapes, but you would do something like this and then trying to restore hearing. So now it has the flexibility to vibrate where it didn't before. All right. Not from word parts? None. Fantastic. I would practice the ones from word parts. There's an exercise on 515 that I would recommend. But this brings us to diagnostic terms. For those in MI, you are in a unique advantage or have had it. We've learned a lot of these before. But the key picture or graphic that you would get when you're getting your hearing checked is an audiogram. And I think I have a picture of it. It's on page 516 in your book. But it gives an indicator of both ears, what frequencies you are able to hear, and how well your hearing is. This is captured on an audiometer, so that's the machine itself that's doing the recordings. And the act of doing the process is audiometry. So the whole thing is audiometry. The machine is an audiometer, and the product is an audiogram. If you really wanted to get into what the cochlea specifically is doing, then you can do something called an electrocochleography. So that's where you're going to record basically the electrical signals in the cochlea and look at those hair cells a little bit. Otoscope and otoscopy has to do with looking in the ears or doing your visual examination. I'm pretty sure all of you have had an otoscope shoved in your ear at the doctor at one point. Tympanometer and tympanometry. This is going to look at and measure your middle ear function, essentially. The process would be metry, and the instrument used would be a tympanometer. But it basically gives you an idea of how your middle ear is functioning. Try exercise 18 on page 518. Just to get a use of each one of these. And so depending on where you might have suspected hearing loss, they might use different procedures and instruments to check it out. Okay, so this is what an audiogram looks like, and an audiometer on the left. Clearly this is old school based on how it looks, but it generates a picture over here. So up top you have your different frequencies. We have super low frequency all the way up to high frequency. This is within, human hearing range. And then down the left side here we have decibel levels or volume levels. So it's basically what is the minimum volume necessary for you to be able to hear these different frequencies. So normal range would be up here in the 10 to 20-ish. Moderate hearing loss would be here, and then the lower down you go means the louder it has to be for you to hear it. So that would be showing you severe hearing loss. And both ears can be different. Sometimes they're the same. Here's a person doing a visual examination of the ear with that instrument. So this would be Otoscopy is performed with an otoscope. All right. And this one, answer's already given away, but this is what you might shove in someone's ear to look at middle ear function. It's a little different than just visually checking. It's kind of got a little plug, and you suction it onto the eardrum to get some middle ear function information. All right. Last but not least here, we have some complementary terms. Not a ton, but really most of them are self-explanatory. So the audiologist is the person who checks your hearing. Their field of study is audiology. A general term is oral, not to be confused with O-R-A-L. Oral, A-U-R-A-L, means pertaining to the ear. Yet another reason why spelling counts. Cochlear, we saw this with cochlear implant. It literally just means with the EAR on the end pertaining to the cochlea. An otorhinolaryngologist, if we were to break it up, we have oto is ear, rhino is nose, laryngo has to do with your like windpipe, so it's generally the ear, nose, and throat doctor, or an ENT, which is why it's called ENT. If someone or something is suspected to be troubled with the structure of the ear, for example, then you would go to an otologist who studies and treats the diseases of the ear. Their field is otology. Vestibular has to do with the vestibule. There's a vestibular nerve. Vestibulocochlear has to pertain to both. There is, the vestibular nerve and the cochlear nerve come together, and that's kind of where we would use vestibular cochlear nerve. So give those a go in exercise 21 or 22, just to kind of get that last bit of words in. And, of course, and very happily can say that there are no not from word parts for complementary. Which brings us to our very, very short list of abbreviations. These were kind of shown throughout. We have two types of OM, so just to kind of bring that back a little bit. OM is otitis media. If it's just a short, quick infection, then you might have AOM, acute otitis media, so it just kind of depends. ENT is that ear, nose, and throat, otorhinolaryngologist. And HOH, I don't think that was specifically introduced. It just means hard of hearing. So if someone is diagnosed as HOH, that means they're having trouble hearing. Okay, so who's going to do this exam with the otoscope? Usually it's your, family physician, who oftentimes is an ENT. You can also be an EENT if you are super ambitious. That would be an eye, ear, nose, and throat doctor. Okay, so at the end of every chapter, as always, there is that pronunciation piece. So this passage, for example, is on page 525. Practice these in context, work through the content quiz, work through all of your resources, and you should be good to go. That's it.